So today is Friday, September 20th, 2024. I had my last TMS session, session number 38, like 3 days ago on Tuesday. I'm absolutely exhausted, and I'm pointing this out because I realized that on Wednesday, so the day after my last TMS session, I came in and tried to record a video to talk about what my last session was like and talk about something that was disappointing to me that the TMS technician said to me, which you guys will get to hear later on in the video. But as I was trying to record that on Wednesday, I got interrupted because someone was knocking at my door, so I had to stop the video. And I completely forgot that I had already started that video. So today I came home from work and started recording a video to talk about my TMS experience as a whole and whether or not I feel like it was worth it. And then when I was going to upload it, I came across that half-finished video that I was talking to you guys about that I recorded on Wednesday. And that was just 2 days ago. And I'm going to post it on here. I'm going to embed that half-finished video in this video so you guys can kind of see a difference in my demeanor and how I was looking and how you guys think that I was feeling on Wednesday as opposed to today. And this kind of just goes with that point that I was trying to make in an earlier video, that by the end of the week, I'm so mentally exhausted and drained from work. So you guys be the judge of that. Compare how I look and how I'm speaking now to the video that I'm about to post, which is the video for Wednesday. And again, that one is only halfway finished. So after that, I'm going to add the other video, which is the other part of that chat that I recorded today. So this is going to be quite a long video. It's probably going to go about 30 minutes long, maybe a little less than that. So props to you if you are able to make it through. I'm going to talk about my TMS experience from start to finish, whether or not I feel like it was worth it. Talk about depression, a little bit about medication, and then I'm going to finish off the video just by talking about how stressful this week has been and a couple of things that have kind of been going on at work. Yesterday was my last TMS or transcranial magnetic stimulation therapy session for depression and anxiety. If you've been following my TMS journey, I have had a total of 38 treatments. Yesterday, the TMS technician said something that kind of threw me off, maybe because I'm naive, maybe because, I don't know, I always feel like I'm too honest, right? But like I was kind of disappointed because every week they have me fill out the PHQ-9, which is a depression rating scale, right? To see kind of how my symptoms have improved. So at the very beginning, the very first PHQ-9 survey that I filled out before I started treatment, my score was a total of 16. And I want to say that throughout the weeks as I've been going through TMS, I have seen a decrease in my total depressive symptoms, according to the PHQ-9, of about 3 to 5 points. So it has varied, right? Like most of the weeks, I want to say the difference was only about 3 points, which is not much. I know that at some point, during the past couple weeks, I saw my PHQ-9 was down to 11, right? But I think that's the lowest that it's ever gotten, that it's ever actually gotten, just the 11 points. And in all fairness, it is kind of hard for me to gauge whether or not I'm feeling better. And I talked about that in a previous video. But anyway, he said, are you thinking about maybe doing TMS in the future? And I said, possibly. Maybe not anytime soon, but if I feel like a return in the like depressive symptoms and whatnot, I might consider it. Who is it? Today is Friday, September 20th, 2024. It is 5:22 p.m. and boy, has it been a long week. I concluded my TMS treatment this week on Tuesday. So my last session was Tuesday, September 17th. And that was session number 38 of transcranial magnetic stimulation therapy, or TMS, for depression and anxiety. If you've been following my journey, you know that I was getting bilateral stimulation. So they were doing the treatment on both sides, left side for the depression and right side to treat the anxiety. And they started with a protocol of 120 motor threshold or intensity. I guess that's how hard or how fast, how hard I think the machine is tapping at my skull. And as you know, they started me off pretty low, right at about 40, I think, when I started my treatment a couple months ago, and then gradually, as the days went on, they would increase the intensity. So this was a very intense. TMS is intensive. It was, for me at least, a 5-day a week commitment. So I would go to work, and typically I work 7:30 to 4. Those are my regular work hours. I work for two schools as a speech therapist. But for the TMS treatment, I started it over the summer. Like the last week of summer break was when it was finally approved for my insurance. And I still had a copay that I had to pay out of pocket for every session. It was a $30 copay, which doesn't sound like a lot, but think about it, right? 5 days a week, that's 150 weekly. And then if you add that up monthly, that's like, I don't know, is that 600? Yeah, I want to say 600 a month, or I could be wrong because I've never really been any good at math, but I think that's right. Anyway, so it gets pretty pricey, but nothing compared to what I would have had to pay if my insurance hadn't covered the majority of the treatment. And I know this because 2 or 3 years ago, when I had a different insurance, I was on a different plan before I started working. They were trying to charge me $5,000 out of maybe a little. I think it was a little over $4,000 out of pocket for the TMS treatment, and I just couldn't afford it, so I couldn't get the treatment at the time. But then when I finally started working, I got this insurance with Anthem, and found out that it was actually covered, and they cover a good amount of it, and they do have like prerequisites that they want you to meet. So they want to know that you've tried like some sort of psychotherapy or counseling, which I had, and they want to know that you've tried, I think, a minimum of like 3 different antidepressant medications. And that's how they define, I guess, treatment resistant depression. And if you've been following my videos, you know that I've tried like a million different antidepressants. So I really had no problem, um, proving that I did indeed feel like I had treatment resistant depression, because I've tried all these different medications, all of these different things, and I've been to therapy, and nothing appeared to really help very much. And so that's how I started my TMS journey a little over a month ago. I'm like 2 months ago, actually. And yeah, so this was my last session on Tuesday. Sorry, I'm very exhausted, so this video may not make much sense. I'm sorry if I'm like talking in circles. I'll try to focus. I'm just very tired. Okay, so they started increasing the threshold. The initial protocol was 120 on both sides as far as the intensity. Eventually, they reached, I want to say about 2 weeks before my treatment ended, is when they reached the 120 on both sides. And the doctor then decided to increase the MT, or motor threshold, on the right side for the anxiety up to 140. So I I ended up with 120 on the left side for depression and 140 on the right side for the anxiety. It was not painful for me, right? There were some instances when they were reaching the higher threshold, like toward the end, when it was like, okay, that feels a little bit uncomfortable, but it was not painful. Everybody has a different pain tolerance again, so this is just my experience. And I think that my TMS team and TMS technicians as a whole were very mindful about not starting me off at a too high of an intensity, and checking in with me periodically throughout sessions to make sure that if they increased it as they increased it throughout the session, that it was still tolerable, right? They would ask something like, oh, is that still feeling okay, or how are you doing? Overall, my TMS technicians were great. I was a little disappointed though on my last session, and that's because I came in and every week they had me fill out the PHQ-9, which is the depression questionnaire. I had to fill that out before I even started treatment so they could get a baseline for me and kind of see where I was at. And I think my very first PHQ-9 score was 16 points, right? This is a questionnaire with all kinds of questions regarding depression, like how often do you feel down? How often do you have little interest in doing things? How often do you feel like you're a failure? How often do you have like suicidal thoughts and that kind of thing? Which is not something that I that I struggle with, thankfully. The suicide thing, the suicidal ideation, is not really something that I have struggled with. It's just the depression and the depressive symptoms. So I filled it out at the beginning before treatment, and it was like a total of uh, 16 points. And every week, like every Monday, they would have me fill out the rating scale again. And I want to say that it fluctuated between, I want to say at the lowest, it was probably like 11 points. But I want to say that for the most part, it really only went down maybe 3 or 4 points. And it's really hard for me to objectively measure whether or not this treatment actually helped me. I think that I have had a lot of anxiety provoking and anxiety inducing situations going on at work lately, and I think I've probably handled them better than I would have before I started treatment. So that is a good thing. I also mentioned, I don't know if I mentioned this in a previous video, but I didn't take uh, my stimulant medication. It was sometime last week. I think that I didn't take it because I ran out and I forgot to refill it, and it was over the weekend. And typically when I don't take the medication, I feel like crap. I really feel down. And actually for those 2 days that I didn't have my medication, I didn't feel too bad. And I don't know if that's because of the TMS or not, but I'm back on the stimulant medication now, which is the 26.1 milligrams of azstarys for ADHD. And that's the only medication I'm taking, and that's really the only medication that I've taken throughout the course of my TMS treatment. I haven't really been taking any like antidepressant or anti-anxiety medications. I think at what I was like at the beginning, maybe for the first week, I was still on the Effexor, which would just make me more tired. And I think I was taking clonazepam for the anxiety, which I also stopped taking. I don't know if a 3 point difference on the PHQ-9 scale is really worth like the huge time commitment that I had, that I went to TMS for. Now, I'm not saying that it didn't help. It's hard for me to tell. I feel like for someone who's depressed, it's kind of hard for us to tell if we're getting better or not, right? But just because I lead such a busy life where I work all day, and then for the past 36 treatments, right, I would get out of work, at 3, I had to request family leave. I had to request a family leave authorization. So I had to fill out paperwork for that so that I could start getting out of work an hour early so I could get to my TMS session on time for my session, which was at 4. So I would leave, I filled that out. I would leave work at 3, get there at 4. I would be there for about 45 minutes to an hour. And then I would come straight home, and like 3 days out of the week, I would be here by about 5:30, 5:45, and I already had to jump into my classes via Zoom because I am currently in graduate school. So because I lead such a busy life, I think, again, it was like 2 hours of my time, right? So a half hour to get there from my job, 40, like 5 minutes to an hour at the actual treatment site, and a half hour to get back. So that's like 2 hours that I could have spent taking a nap or spending time with my son or catching up on schoolwork, what have you. So just know that if you're going to go into the TMS treatment, know that it is a big time commitment, right? And I never missed a day. But I do think that because I don't drive, sometimes my parents would be late to pick me up from work. And I think like 2 or 3 times they had to cut my treatment short because I got there late. But other than that, I was really consistent about going every single day. I was disappointed because my technician, when I went in for my last treatment, basically said to me, this is your last treatment. Are you planning on coming back for subsequent TMS treatments sometime in the future? And I said, I don't know, because I feel like I have like seasonal depression. Of course, I don't have an official diagnosis, but my depression tends to get worse around the winter time, which is just around the corner. My diagnoses are major depressive disorder, cerebral palsy, generalized anxiety disorder, and ADHD. I said maybe in the future, if I feel like it's really bad, I might try to come in for some sessions again. And he said, well, the reason I'm asking you that is because insurance can be very difficult about what they approve. And so if you wanted to get approved in the future for more sessions, they want to see at least a 50% reduction of your symptoms. And so what we tell patients is we kind of have to coach them that if they want to come in the future, that for this last PHQ-9 scale that I'm going to have you fill out, that you cut it in half from what your original depressive scale was, which for me, I think was 16. And then I said, okay. And like, I was disappointed because I was like, he's coaching me, telling me to lie about my ratings. He's like, what I have to tell you is think about like throughout the sessions, throughout these last 36 treatments, think about the best that the absolute best that you felt on any given day. And that's the rating that you should use for your PHQ-9 scale today. But for you, a 50% reduction would be an 8. And like I said, I think that the lowest I remember my score being, it was like an 11, and then like the last week, I think it was 13. So I was disappointed. I was like, this feels wrong. It feels unethical, but I understand because speech language pathology, which is what I'm going through to grad school for, is it's not speech therapists don't just work in the schools, right? They work in the medical field too. And I just had my first internship last summer, and I worked with adults who had like strokes or had like accidents that caused some loss of language, right? So like brain damage will cause, sometimes it causes aphasia. So anyway, my supervisor one thing that she kind of kept telling us was that insurances can be difficult and they want to see progress. And I remember one of my patients had that I saw last summer, and it was via telehealth, via Zoom. She had been recently diagnosed with Alzheimer's, and as I was looking for a treatment method for her, for speech, I found a treatment that helps her maintain some of her vocabulary with enough repeated practice, and it's literally called like maintenance therapy for dementia. And after I assessed her, I wrote in my report, this is the treatment method that we're going to be working on, that we're going to be using, that I'm going to be using in sessions. This is a treatment method that I found that I think will be really effective. And because it's called maintenance therapy, my professor said, you don't want to call it maintenance therapy because the insurance in the real world out there would not approve that, because they don't want to see maintenance, they want to see progress, which to me was absolutely ridiculous, because just the fact that I was able to find something that would help somebody with this debilitating disease, which is Alzheimer's, retain some of their knowledge for longer, that to me was like a miracle, right? Um, I was amazed that there was even such a treatment out there. So, in a way, I guess I understand where the TMS technician was coming from, and the actual doctor, the psychiatrist who sets up the protocol, is probably the one who asks them to kind of coach the patients that if they're going to come back later, that they have to essentially lie in their last PHQ-9, and so that the insurance can see a 50% reduction of symptoms. Still, maybe I'm just naive, but it just didn't feel right to me. However, the TMS technicians, like I've said before, they are great. The TMS clinic was great. As far as clinics, I would recommend it because, again, they were very accommodating and very patient with my exaggerated startle reflex, which I tend to suffer from, and which I've talked about in the past. They were very accommodating about, like, if they knew there was going to be a sudden loud noise that the machine was going to make, they would let me know beforehand so that I was prepared and I wouldn't startle so much. Before the machine started like pecking at my skull, they would let me know, like, okay, here we go. It's going to start in 3, 2, 1, now. Why? Because that sudden stimuli would otherwise make me startle. Now, would I recommend TMS? If you've tried a bunch of different medications and you're in a dark place and you have tried therapy and none of it is working, I would say go for it, because even a 3 to 5 point change or reduction in the PHQ-9 scale could make a huge difference, right? For someone who is like moderately to severely depressed. But would I pay out of pocket for this? Not for the results that I got out of it anyway, but everybody is different, right? Just because I didn't feel like a huge improvement doesn't mean that you won't. Some people say that the improvements that they did feel, they actually didn't feel them until like weeks after their actual TMS sessions. So there's still that, right? So in about a month, if I haven't already, or if I've forgotten, somebody comment down below and remind me to make an update about like a post TMS update a month later, to see if like I feel like my mood has improved any more than what I've already talked about here. And then plus I don't have my final follow-up with the psychiatrist until about sometime in October. So I will let you guys know how that goes. Now, what I will say is that definitely look into your insurance, see if you have insurance, see if they can cover at least some of the costs if you're thinking about going forward with the treatment. But then again, this is just my perspective. I'm not a doctor. I'm not a psychiatrist. For actual medical advice, I would definitely advise that you go and see a doctor or a psychiatrist. This is just kind of my point of view after having gone through the treatment. It's getting darker outside, and the days are getting shorter. And like I said, this is when my mood really starts to shift. Today was not a great day. We're shifting away a little bit from the TMS. My son's school is a dual immersion school, so their core instruction is both in English and in Spanish, and they're very much about learning about Latin American culture, right? They incorporate special days like Independence Day for different Latin American countries. They have celebrations, right? They even have their music class. They have a special class where they um, train little ones to be mariachis, so to be like a mariachi band type of thing, which is really cool. So they're really culturally inclusive because they are a dual immersion school. So that's kind of their focus. And the reason why I enrolled my son in that school is because I'm an immigrant. I was born in Mexico. I speak Spanish fluently. My parents only speak Spanish. My son, I was having a really hard time getting him to speak Spanish with me because he knows I speak English and he was more comfortable speaking English with me. So I decided I'll enroll him in a dual immersion school. And that is also the school that I'm currently working at as a speech therapist. And I've been there for almost 2 years. So I've been there in December of this year. It'll be 2 years because I started December of 2022. Since September is Hispanic Heritage Month, they've been having little events and celebrations throughout the week. And today they were breaking piñatas. It wasn't just their class, other elementary grades and classes in their school. They were each breaking a piñata, and I asked his teacher, is there anything that you would like me to bring? And she said, well, the piñatas are already, we've got that covered, but if you could bring something for them to eat, like pizza or something. I said, okay. So I ordered the pizza ahead of time. I ordered it last night, and I let them know that I wanted it to be ready by around 11. And I was going to be working, but I asked my mom to pick up the pizzas and drop it off drop it off in the front office in the school, so I could take it to their class. Mom gets there, and this is around my lunchtime. And she calls me. She's like, hey, they're not letting me bring the pizzas inside. They say that they can't because it wasn't approved. The teacher didn't request for it to be approved by admin. If it's not approved beforehand, we can't bring any food in, which to me is kind of ridiculous, right? So I went to the front office. The receptionist, who knows me and I'm pretty close with, she was like, I'm sorry. Admin's orders, they said we can't let anybody bring food in if it's not approved beforehand. And it looks like his teacher didn't submit that request for approval. And I went and I talked to the vice principal, who would be an admin, right? I mean, to the principal. And I was like, my mom's already here. I asked her to come and drop off the pizzas. The kids are expecting the pizza at 11:30. And she said, sorry, my hands are tied. I would get in so much trouble if I agreed to let you bring the pizza in and not the rest of the parents who have been trying to bring food in. I can't do it. And I was really upset because I have been working tirelessly at this school, giving it my all for almost 2 years. And for admin to tell me you can't bring pizza in for your son's party, I don't know. I don't know, maybe I was expecting special treatment because I work there. But for some reason, that really bothered me. And I was just like, I can't hide my face. When I'm mad, I am mad. When I'm angry, my face will tell you. And I was like, all right. I just walked out of there. I called mom and I was like, you know what, mom, they're not letting me bring the pizza in. I'm sorry. And I went to my son's classroom and his teacher opened the door. And she was like, "Oh, the pizza's here." And the students were all like happy and expecting pizza. And teacher went out to greet me, and I was like, "I'm sorry, but they're not letting me bring in the pizza." I talked to admin, talked to the principal. She said no. And the teacher goes, "You know what? I think it's just because the principal doesn't like me." And I was like, "I'm sorry." And I think the teacher could tell I was upset. Like, I was so angry that I felt like I was going to cry. I don't know if I was overreacting, but that's how much it affected me. Um, and I bring this up because I know rejection sensitive dysphoria is a thing for people with ADHD, even though technically it's not like scientifically validated or whatever, but I do feel like things affect me a lot more than they should. But I don't know, you guys tell me if you think that I'm overreacting by being so freaking pissed by the fact that they didn't let me bring the pizza in. Um, Basically, I put the pizza in the teacher's car, and the teacher said, "You know what? I will give them a slice as they're walking out and leaving. That way, at least when they're dismissed, they'll get their slice of pizza. I'm so sorry." And I'm like, "It's okay." Like, I felt my eyes getting watery. That's how upset I was. So I didn't even have lunch because I was trying to figure out this whole mess. And I only get a half-hour lunch. So by the time I got back to the speech room, my next group of kids was already there waiting for me. So I didn't have lunch today. Um, so that was today. And I think that one incident ruined the rest of the day for me because I was upset for the entire day, and I still am. Wednesday, we had a meeting after school with the MTSS team, which is the team that's in charge of educational intervention. That's who we go to before we refer. That's what the process that the students are supposed to go through before they're referred to, like for a special education assessment. Um, and it was the MTSS the MTSS team, the special education department, which would be me as a speech therapist. I'm part of the special education department, or SPED. The SPED director was there, the school psychologist, my supervisor, who is the other speech therapist who has been working there for about 10 years, um, a couple of the special education teachers. So we had a couple of SPED teachers there. And then the general education teachers, all the teachers were there. And the point of the meeting was to educate the general education teachers, who a lot of them are not really that familiar with how SPED or special education works, educate them on what an IEP document looks like, what accommodations are, and what modifications are, and how they would follow that, or what accommodations they could give the students if their students happen to have a disability, whether that be a speech or language impairment, which is something that my supervisor and I would kind of be in charge of assessing, or a developmental disability, or autism, which is more of like the school psychologist role, right, to assess and talk about. Every corner of the room had a poster up with a hypothetical scenario of a disability that a student could have. Like, so and so, for example, so and so, this kid has a speech and language impairment that causes him to be unable to say his speech sounds properly, and he misspells things when he writes things, and he has trouble like writing things and pronouncing certain sounds. What accommodations could you put in place in the classroom setting to help support your student? So every corner had a hypothetical scenario like that, like a big poster with a scenario, and teachers were given markers, and a specialist, someone from the SPED department, was told to stand at each corner to talk about what kinds of accommodations or modifications could be put in place for that specific student. And of course, because I'm one of the speech therapists there, I was put in that corner with that scenario that I just told you guys about the kid with the speech impairment, the articulation impairment. And man, it was really difficult for me because like the teachers would come up in groups and I would be at the center, and they would be around me and they would be asking me all kinds of questions. And some of them I didn't know how to answer. So it was nerve-wracking to say the least, and I could feel my face turning red, and I was very anxious, and I don't think I did a very good job explaining myself. So that was very anxiety provoking. But anyway, yeah, this video is getting really, really long, so I guess I'm going to go and I will return.